So now we move on, and now we're going to have the presentation of Javier de Frutos from the Spanish Federation of Municipalities and Provinces of Spain. I'll be passing the slides, but Javier, it's your time, whenever you want.
Thank you very much, David, and thank you very much for this invitation and for this possibility to share with this net our work. I work in the Spanish Federation of Municipalities and Provinces. This federation is the association that represents the local authorities in Spain. As you know, in our country, we have 3 levels of administration, national level, regional level, and local level. And at the local level, we are the association that represents the interests of the councils and of the provinces. We are part also of the European Council of Municipalities and Regions. And from this point of view, I will try to share with you our vision about the most important measures and initiatives during the COVID pandemic. First slide. Yes, I will talk about 4 points. Firstly, measures at the local level. Then minimum living income is a measure at the national level. In the third point, the voices of the families. We have a little survey about families and COVID, and I think that it's interesting to share with you this little survey. And then I will explain in a few words the collaboration between FEM and the Ministry of Social Rights and 2030 agenda. Next slide, please. At the local level, I think that it's important to underline and to highlight the very important role in the emergency aid focused in situations of vulnerability. During the COVID emergency, this kind of help was very important to work in situations of need related to child poverty. Councils are the first answers and the first answer in the crisis, and I think that the work of the council was very, very important. In second place, also at the local level, we have the implementation of a specific aid in the following fields: dining scholarship initiatives and technological support for online teaching. And finally, the adaptations of services for families and children, prevention measures due to the pandemic. Next slide, please. Yes, I would like to share with you a very important debate that we have in our country about the crisis. We have a debate about the measures that must be more important during the crisis, because in the last crisis in 2008, we have a lot of measures from the point of view of the economical point of view, financial point of view, but we don't have a real social plan to resolve, to try to make front to the crisis. And in this period of the pandemic situation, the country has a very interesting debate trying to promote a social answer. And I think that the most important measure for this social answer was the minimum living income. The minimum living income is a benefit aimed at preventing the risk of poverty and social exclusion of people living alone or who are part of a cohabitation unit and lacking the basic economical resources to meet their basic needs. It is defined as a subjective right to an economic benefit, which is part of the protective action of the social security. Next slide, please. In a few words, the minimum living income is an essential step to guarantee the necessary income for families in vulnerable situations. And we have this minimum living income we start with this minimal living income during the pandemic. I think that is very important to underline that. Allows a response in the national framework, and it's a deep social measure to face the crisis. Nowadays, the minimum living income is being implemented in all the territory. There are different difficulties, lack of coordination, bureaucracy, but it's necessary to highlight that this policy represents a crucial item for a lot of families. Next slide, please. As I said in my presentation, in our work in positive parenting, we have a website, is Familias en Positivo, Families in Positive, and in this website we will have in a few days the results of a little survey about the voices of the families. The pandemic has forced us to contemplate and rethink the multiple scenarios of family life to receive the appropriate differential support if necessary. As a result of this exercise of facing challenges and difficulties, positive learning has also been derived. The families shared the importance of the following values and strengthened that have identified after these times. There are 6 items that I would like to present. Firstly, the value of family, the importance of maintaining a healthy family relationship and their ability to overcome challenges together. The next item is the relevance of resilience in order to face adversity and the ability of families to learn and adapt to new challenging demands. In a third place, the existence of a public health system has allowed us to have a protective valve in these difficult times. This public system of health was very, very important during the pandemic and is now in the debate for the future, trying to keep this system of public health. Then the next item, next slide please, the arrival of teleworking as a new tool to improve personal, family, and work conciliation. The next item is the value of communication and collaboration between families and professionals and their support provided. And finally, the value of the social and community support network, being able to participate both to receive and to offer help and resources in society. Next slide, please. Family diversity is also reflected in the support needs that families have experienced during the pandemic. Listening to the families, it's possible to highlight the following needs. The need to have the computer equipment to face both the demands of distance education for their sons and daughters, and also the need to establish virtual contacts with the support networks. In the second place, the need for emotional support to cope with anxiety, stress, burden, or grief over the loss of a loved one. In the third place, the need for the conciliation of personal, family, and work life. And finally, the need for specific support for families with intellectual disabilities by adapted measures to the new situation that will allow not to lose the skills and competencies acquired so far. This is the most important results of our short study about the situation and the voices of the families. And finally, I would like to present one project that is the reason for that we are here in this network. It's our project Familias en Positivo, that this project continue with his works during the pandemic. And I think that is important to present in a few words the work that we are doing with the Ministry of Social Rights and Positive Parenting. The collaboration between FEM and the Ministry of Social Rights regarding positive parenting started in 2009. In 2010, we start with elaboration of different documents. And after this first approach, the collaboration between FEM and Ministry of Social Rights has been focused in to integrate the positive parenting in local policies for support families. Next slide, please. As a result of this collaboration, we have two tools that want to be key references. The online platform, Familias en Positivo, is a space of information and exchange for the families and for the local governments. And we try to keep the activity of this platform, address it also to the families during the pandemic. And the second place, the best practice guide for positive parenting is also in English in our website. Want to be a resource for practitioners working with families. You can see the first page of our platform. There are different news, there are different documents and references. It's a platform also for the families, but it's a platform that has a specific place for the practitioners. In the next slide, we can see this part that is an intranet, especially for the practitioners. And now there are more than 2,000 practitioners in the local authorities that use this intranet to try to improve their work. The next slide is just a short schema of our system of collaboration. There are 7 Spanish universities in this work. There are also the administration, and there are also the practitioners. I think that we try to reproduce this framework that John Canavan presented at the beginning of this webinar. The next slide is just a definition of the characteristics of a professional, of best professional practice. But in the next slide, I can present you in a few words. Next slide, please. That we have also in the platform the application of the best practice protocol as a tool to evaluate a service or a program. Requires directly or indirectly the involvement of all those individuals who are involved in the service, and it's based in their knowledge and experience. The protocol does not attempt to evaluate the competencies of a single professional in particular, but rather aims to find ways to support the advancement of an entire service and its professionals. We have this application that has at the end that want to make reflections in the service and trying to produce a plan to improve the service from the point of view of the positive parenting. This is one of our principal tools that we have in this platform. The first task of this application of the protocol is to recognize and strengthen the presence in the service of those best practice and indicators that were determined to be filled in the application of the protocol to ensure they will be maintained. And the second task is to develop an improvement plan addressing those best practice and indicators where new questions arose and or which did not receive positive assessment. This is our, in the next slide, you can see exactly in Spanish, the definition of a best practice, the questions and the indicators. And it's a tool that allows local authority to make a reflection about their work and to try to make a plan to improve and to think all this experience from the point of view of the positive parenting. We try to keep and to disseminate this work during the pandemic, and we think that in the future this work will be important in terms of results in the work of local authorities. In the next slide, you can see the second part of this protocol. And finally, there are questions about the programs, evidence-based, trying to identify the the positive things and the problems that these programs has from the point of view of positive parenting. Thank you very much. I will try to I try to make a presentation of different work that we have developed during the pandemic, and this work that is our principal work from the point of view of positive parenting. Thank you.
Thank you, Javier. Again, I have a virtual round of applause to Javier, and thank you for a lovely presentation. So again, we might just open up to the audience in terms of comments or questions. Again, use the chat, stick up your hand on the chat, and if you're happy to ask a question.